Now we're going to do just a regular shift assessment. So not a full head to toe, but a systems-based assessment that you would do normally every shift just to make sure that your patient is okay. So Mike, I'm Catherine. I'm going to be your nurse today. Is it all right if I just listen to you and do some things?
Of course.
Awesome. Okay. So first of all, have you had any pain? Are you having any pain anywhere?
No, just my head's been hurting from nursing school, but other than that.
I've heard that nursing school can be like that, but that's okay. What would you rate it at?
Probably a 15 out of 10.
15
yeah,
out of 10?
yeah.
So normally 0 is no pain and 10 is the
Oh.
worst that you can imagine,
Yeah.
but you know, I can see the 15,
Yeah,
no
for
problem. Okay. Have you had any issues with dizziness, anything that I need to be aware of?
No.
Okay, and I'm probably going to ask you these questions again as I go through. Is that okay?
Fantastic.
Awesome. Okay, so first I'm just going to go ahead and listen to your lungs. Is that okay?
Yeah.
That's a good deep breath. I appreciate that.
Yeah.
And I'm just listening every couple of inches. And again, it's going to be every couple of inches back and forth, okay? And just keep doing those deep breaths, but don't hyperventilate, bud. Awesome. Are you having any shortness of breath, any cough?
No, other than you taking my breath away.
Ha ha, ha ha. All right, so now I'm going to listen to your heart, and I'm going to feel your pulse at the same time. Do you have any history of AFib or irregular heartbeat at all?
No.
Okay, and it's going to seem like I'm listening for a really long time because it takes a whole minute, but I promise nothing's wrong. It just really takes that long to do.
Okay.
Now, have you had any chest pain, any loss of sensation in your arms, especially any pain radiating down your left side, anything like that?
Not at all.
Awesome. Now I'm going to look at your eyes. Okay.
All right.
Now I'm looking to make sure that your pupils move the way that they're supposed to, so they should go in and out with the light. That's normal. Okay. Perfect. Now I'm just going to have you follow this just to make sure that your eyes move the way they should. Okay. Any trouble with that?
No.
Awesome. All right, so next I'm going to look in your nose just to make sure you don't have any bleeding or any issues, okay? Perfect. Okay. Now I'm going to look in your mouth, and I'm looking for any yeast or maybe some broken blood vessels, some redness, irritation, anything like that. Have you had any trouble swallowing?
No.
Perfect. Everything looks rosy. Now I'm going to look at your ears. Do you wear glasses or anything?
No.
Okay. Sometimes when you wear glasses or if you wear oxygen at home, you can end up with ulcers on your ears.
Oh, okay.
So, cool. All right, so now I'm going to see how strong you are. How's that?
Yeah,
All right?
that sounds pretty good.
All right, so squeeze my hands just as hard as you can. Good. Okay. Now, I want you to try to push my hands up, and I'm going to push down. Good. Now do the reverse. I'm going to try to push up. Good. Good. All right, so now I'm going to look at your feet. So I'm going to grab pulses, and that is just kind of where the foot starts to slope up into a bone, okay? And then there's also one right behind your ankles, just in front of that Achilles tendon. Cool. All right. Now, I want you to push up with your feet. Good. And I want you to push down with your feet. Awesome. Now we're going to do the same thing with your legs, okay?
Oh, okay.
So push down. Okay. Now don't let me push you down. Awesome. Good. And don't let me push you down. Perfect. Do you have any issues with walking, dizziness, falls?
No.
No. Okay. And then I need to listen to your belly if that's okay. So I'm going to have you lay back.
Yeah. Sounds good.
There we go.
Oh.
Now, are you having any nausea?
No nausea right now.
Okay. Are you having bowel movements okay?
Yeah.
Any trouble urinating?
No.
Okay. Because I don't want to push and cause a full bladder to hurt.
Of course.
Nice tummy grumbles. Does it hurt when I do this?
No.
Here? Here? Awesome. Okay. Now, do you have any other skin issues that I might need to know about?
No, I don't. Other than I had a sunburn a few weeks ago.
Okay, did that heal up okay? Okay. And I'm gonna look at the skin on your legs actually. So if you were having issues with your platelets being too low, for example, you might have petechiae or bruises here where you're standing and where your legs are kind of dependent off and on, okay? And I also don't see any edema and I don't feel any. So if you've got a patient who's been in a hospital bed, you're actually not going to take their word for it that their skin looks good. Sometimes they're not alert enough, and sometimes they're just too embarrassed to tell you. So you're actually going to look at their skin. So anytime that your patient has an issue that you know that you need to assess more thoroughly, then you do need to take the time to add that on to your shift assessment.